I'm going to talk about Asperger's syndrome. I think you don't really know much about it, so okay. I will start by defining Asperger's syndrome. Asperger's syndrome what the Asperger's syndrome is an autism spectrum disorder, or ASD, named after an Austrian pediatrician, Hans Asperger. Do you know what pediatrician is?
Pediatrician.
Yeah, pediatrician is?
Pediatrician. Children doctor.
Huh? Oh yeah, you're exactly right. Okay. Okay, so this pediatrician worked on autism and had a significant role in the world of pediatrics, which is why his name was used. Asperger's syndrome is characterized by significant difficulties in social interaction and restricted and repetitive patterns of interests and behaviors. Some symptoms of the syndrome can be classified into two: speech and society. In terms of speech, the Asperger's patients may have speech that is flat and uneasy to understand because it lacks rhythm, pitch, and accent. They also have odd inflection. What I mean by this is that changes in their voice, in its tone or pitch, is little peculiar. Lastly, they are unable to modulate the volume of their voice in particular situations. For example, when a person with this illness goes to a theater or a museum, he or she is unable to control their volume and may make noise. In terms of society, the patients are isolated from people around them because of their abnormal behaviors and characters. They may be active in childhood, but they're not in adulthood. They also lack motor skills such as riding a bike or riding something with their hands. They may feel anxious and feel depressed in a normal day. Lastly, the patients of Asperger's syndrome may also develop attention deficit hyperactivity disorder, or ADHD, like what they have said, tic disorders, anxiety disorder, and obsessive compulsive disorder, or OCD. Next is the cause. Exact cause of Asperger's syndrome has not yet been found, but there are several factors that have possibility of being one. First is heredity. According to some researchers, fathers have some contributions to their children's illness, although no specific gene has yet been identified. Next is problem in pregnancy or difficult delivery. A few ASD cases have been linked to exposure to teratogens during the first 8 weeks from conception. Obviously, malfunction of particular part of the brain is one. Lastly, there is the role of the parents. If the parents do not give enough care and love to their children or abuse them, there is a tendency of their children having the Asperger's syndrome. These are the things that seem to be the causes of Asperger's syndrome. Thank you.
Hi, I'll talk about the diagnosis and treatments of Asperger's syndrome. Okay. There are many implements to diagnose Asperger's syndrome, such as investigating the process of linguistic and kinetic development, screening questionnaire on current image, enforcement of face-to-face examination, and other examinations like MRI in order to know the shape of the brain. However, none of these are proven to classify between Asperger's and other ASDs credibly, because this does not fit into the criteria for specific overall developmental disability or graft schizophrenia with different criteria. That is why many children with Asperger's syndrome are initially misdiagnosed with ADHD, attention deficit hyperactivity disorder. However, there are standard diagnostic criteria. They require impairments in social interaction and repetitive and stereotyped patterns of behavior, activities, and interest without significant delay in language or cognitive development. And this kind of diagnosis is most commonly made between the ages of 4 to 11. Diagnosing adults is more challenging as standard diagnostic criteria are designed for children and the expression of Asperger's syndrome changes with age. Adult diagnosis requires painstaking clinical examination and thorough medical history gained from both the individual and other people who know the person, focusing on childhood behavior. For its treatment, Asperger's syndrome should be approached from different aspects. First is integrated family counseling. In this process, parents will be informed carefully about their children's condition and should provide realistic expectations and assist about their children and training particularly in behavioral techniques to use in the home. Second is to help the child understand other people's social activities and realize how their behaviors look strange to others through cognitive therapy. Third is social skill training, and in this, the patients learn to understand social clues through role-playing or telling stories, comics, video recordings, following rules, visual cues, and strengthening positive behaviors. It also helps them learn the pragmatics of mutualism of normal conversation for more effective interpersonal interactions. Fourth is instructing them to follow rules at home, in school, workplace, or local society through behavior modification. It also improves stress management relating to anxiety or explosive emotions and cuts back on obsessive interest and repetitive routines. Fifth is educational intervention, which lets the patient acquire self-help skills to lead his own life and working techniques. It assists with poor sensory integration and motor coordination. 6. Medication would be helpful if they lack attentiveness and have coexisting conditions such as major depressive disorder and anxiety disorder. We have seen some information about Asperger's syndrome. I think we know one person with this disease.
Let me stop.